Nursing is at the heart of CAMC's tradition of excellence. After all, quality healthcare is only possible with quality nursing. That is why CAMC offers the region's best opportunities for pursuing your nursing career. And it may be why more nurses choose CAMC than any other hospital in West Virginia. At CAMC, you'll find everything you need to succeed, including career ladder advancement opportunities, outstanding compensation, and professional fulfillment. The CAMC Nursing Career Ladder focuses on behavioral-based nursing processes that enhance and grow the RN in the clinical setting, enriching their skills through their own research, education, self-reflection, and opportunities for improvement for themselves, their unit, and CAMC health system as a whole. The ladder was created using 9 standards of professional practice identified by the American Nurses Association. These 9 standards of professional practice are used to describe competent level of behavior in the professional role. Registered nurses are accountable for their professional actions to themselves, their patients, their peers, and ultimately to society. These standards have been used to guide the development of the clinical career ladder for registered nurses at CAMC and are included in the validating criteria for each level. The ANA standards of professional practice are quality of practice, education, professional practice evaluation, collegiality, collaboration, ethics, research, resource utilization, leadership. And here is an overview of the 4 career ladder levels and the required nursing skills. The Clinical Nurse 1 is the novice advanced beginner. Our Clinical Nurse 2 level advances to the competent level. The Clinical Nurse 3 is proficient, and at the Clinical Nurse 4 is considered expert. At the levels 2 through 4 are opportunities to advance in your unit to a charge nurse. Also, the career ladder prepares you for management roles to become a clinical management coordinator or a nurse manager. At each level, compensation increases are given to reward the employee for their hard work, gain knowledge, and professional commitment to CAMC nursing standards and practice. Let's take a moment to review the clinical ladder levels. Clinical Nurse 1 and Clinical Nurse 2 are the initial stages. The Clinical Nurse 1 is the novice advanced beginner. The Clinical Nurse 1 level is designated for new graduate RNs and those with less than 1 year of experience. The first level of the career ladder prepares the novice RN with the basic skill to become an advanced beginner by learning independently to perform the beginning stages of an advanced care competency and provide the minimum standards of care for CAMC nursing. The Clinical Nurse 2, or the Competent Nurse level, is designated for RNs with 1 or more years of experience. The second level of the career ladder designates the criteria for the minimum performance level for all RNs at CAMC through competency validation and group processes promoting advocacy, collaboration, and systems thinking. All RNs are mandated to achieve the Clinical Nurse 2 minimum competency levels for performance after 1 year of experience. I began my journey at CAMC in 1991, and the career ladder even then was a huge draw to me to join the CAMC team. After a year of serving as a clinical nurse, I worked with my nurse manager to advance to the Clinical Nurse 2 level. And that allowed me the opportunity to engage more in evidence-based nursing and performance improvement. Clinical Nurse 3 and Clinical Nurse 4 are self-promotional career ladder stages. In developing your career, the levels 3 and 4 require the highest standards of care in CAMC nursing. The nursing processes used to achieve the beginning stages of the career ladder are built on and enhanced to provide evidence-based research and to develop action plans to correct practices of the nurse, the unit, or the institution. The third and fourth levels are self-promotional opportunities that allow you to achieve your career based on your life choices in your own time. The Clinical Nurse 3 is designated for RNs with advanced clinical skills to meet patient needs. The third level of the career ladder designates criteria for providing care and additional active research, formulating long-range plans of care and their effects on patient care, teaching as a preceptor for lower-level RNs, while acting as a role model and a mentor. This level facilitates positive behavior in dynamic group settings, recognizing the need for change in nursing practice while initiating change processes proactively, and identifying potential legal and ethical issues while implementing strategies to prevent problems. The Clinical Nurse 4 is assigned to RNs with the expert level of care and experience that is needed to meet patient needs. The criteria of the fourth level are advanced clinical skills in planning and delivery of care that have long-range implications for select patient populations. A Clinical Nurse 4 represents the best rounded holistic care by coordinating the utilization and implementation of internal and outside resources for patient and staff needs, facilitating interdisciplinary problem solving, and effectively implementing change processes that have unit or organizational impact. This level coordinates organizational QI and research activities and acts as an interdivisional resource to assist with resolution of specific legal and ethical issues. The level 4 of the career ladder requires a specialty certification to be maintained to provide an expert level of care. When I think about my own personal journey on the career ladder, I remember the difference that moving from a Clinical Nurse 1 and 2 into that 3 and 4 arrangement for me. It was personal because it took me from looking at unit level or personal development into a more organizational approach, really implementing modern evidence-based research into practice, looking at quality improvement and all of the things that a nurse could do at the bedside and beyond to make a huge difference. Now let's look at nursing management. The Clinical Management Coordinator, or CMC level, is designated for RNs who aspire to manage an entire unit of RNs under the instruction of a nurse manager. As a CMC, you will gain knowledge and experience by participating in the planning, organizing, supervising, implementing, and evaluating patient services while coordinating work with managers, directors, medical staff, professional nursing staff, and other departments and community agencies. The nurse manager level is designated for RNs who aspire to manage an entire unit or multiple units by planning, implementing, and directing improved services and employees. Many RNs who flourish in the nurse manager career path move forward to become directors, part of the CAMC Professional Nursing Standards and Practices Group, or as hospital administrators. Advancing through the career ladder provided me the tools to grow both professionally and personally. At each step of the journey, I saw the organization at a different level. I was able to see how I could make an impact, whether it be by working through groups or whether it be through leading others, and this led to my decision to be a nurse manager. Being a nurse manager was one of the most rewarding times for me personally and again professionally. It was awesome to see nurses grow and to engage and to work together as teams to fix department level issues, and then again helping promote them to work on organizational issues as well. Leadership is tied directly through at every link of the career ladder, and that is part of what I think has led me to continue that growth outside of the nurse manager role and into administration currently.